Hi, my name is Dr. Matt Willis. I'm a shoulder specialist at Tennessee Orthopaedic Alliance, and I'm here to talk about rotator cuff injuries. First, I want to get into the subject of what a rotator cuff is. Most people think of the rotator cuff as a common injury only in athletes. That's actually a misconception. It's one of the most common problems that I see in my office for patients of all ages. The rotator cuff is actually a series of muscles, 4 in total, that surround the scapula or shoulder blade and connect to the ball part of the ball and socket. The rotator cuff is important for a number of reasons. The main reason is that the rotator cuff helps to hold the ball in the socket and allows some of the bigger muscles to move the arm. There are several different ways that patients can get a rotator cuff tear. What we call acute, which means some type of accident or injury. But what's actually more common is what we call a degenerative rotator cuff tear, which is more of the wear and tear type of injury. So how do you know that you have a rotator cuff tear? One of the most common misconceptions is that the pain is only at the site of the tear, which is in this area. In fact, rotator cuff pain generally radiates down into the arm, a little bit lower, and can go all the way to the wrist. One of the most common complaints that I hear in my office is that it disrupts sleep. So frequently people wake up many times during the night complaining of pain. Another misconception of rotator cuff injuries is that once you have a tear, you're unable to raise your arm. Although that's true in certain cases, many people can have partial or even full thickness tears with full range of motion. Again, pain is one of the primary symptoms associated with this condition. Some of the risk factors associated with rotator cuff injuries include age greater than 65, repetitive outstretched or overhead work, and smoking. The majority of rotator cuff injuries can fortunately be treated non-surgically. The foundation of non-surgical care includes things like medications, even creams or gels or patches to help alleviate some of the discomfort. Physical therapy is a mainstay of non-surgical treatment. Injections, if the patient has significant amounts of pain or dysfunction, can be very helpful in the management of this condition. Again, the majority of patients can be treated effectively non-surgically. However, occasionally that doesn't work. When that happens, there are surgical options for treatment. After surgery, there's frequently a period of recovery that usually involves some form of rehabilitation in the form of physical therapy. It usually requires several months and even up to 1 year to be as good as you're going to get after any orthopedic procedure, particularly rotator cuff surgeries. There are a wide variety of treatment options to address every type of rotator cuff injury, all the way from the small partial tear up to the large unrepairable tear. There are always options to treat your pain.